Please don't keep us a secret. Tell everyone about Vozetta Telemedicine. Social distancing friendly and virtually free. Vozetta Telemedicine. Give Vozetta a try.
Good morning, good afternoon, everybody. Depends where you are. Thank you so much for joining us, joining our weekly meeting during this emergency time. This is my contact information. My name is Robert Gabriel, President and CEO of Microwize Technology, and also President and CEO of Vozetta Telemedicine. I also have a couple of people who's going to help me today, especially when we get to the telemedicine coding. Amir Gadalla is the RCM General Manager, and Nesma Abdelaziz, she's the RCM Team Leader. Just a couple disclaimers. Microwize or Vozetta cannot be held responsible for any loss of revenue or data or the health of the patient. You need to verify the information yourself of anything you learned today. This is not my area of expertise, but I just want to make sure that everybody's aware of all the funding and the loans that the federal government is offering. And there are 4 types of loans. And if you haven't done that yet, hurry up. They've actually ran out of money, but they're injecting more money into this plan. So if you haven't done it yet, please go ahead and apply one of those loans. So those are the 4 different options if you haven't done that yet, because that's really important for the health of your business or practice. So it doesn't matter if you're a billing company or it doesn't matter if you're a medical practice. It's a business, and there is funding available to keep you healthy as far as financially. And the rest of this meeting today is how to keep you healthy and run your practice remotely without putting yourself or your staff at risk if you want to operate remotely. So this is the agenda today. We're going to talk about how to deliver top quality healthcare from anywhere. We're going to talk about the billing codes in telemedicine, how to file your claims, and how to collect money from patients, and so on. So let's get started. So the first thing is one of the challenge of operating remotely is a lot of people don't have the same setup. So by not having the same setup, it makes it more difficult because you might have bookmarks, you might have passwords, you might have things like that. You want to make that as easy and as efficient as possible. I have a replica of my setup, and it doesn't matter which office that I work at, I can be up and running in just by 2 minutes of logging in, and I have everything at my fingertips, just like if I was at my main office or remote. So let's talk about some of those technology. Now, not necessarily those technology that we offer at Microwize, but I just want to make sure to give you all the tools that makes it simple for you to operate remotely without missing a beat. So the first thing I'm going to talk about is the browser. Favorite browser is Chrome. With Chrome, when you logged in with your account, you're able to see all your shortcuts. You're able to see the searching that you've done before. So if I'm searching, it knows what I've been searching for, and I don't need to remember that again. So it doesn't matter which computer you logged in, it remembers your searching, it remembers your shortcuts, it remembers your bookmarks. So that's important to log into your browser and to create an account, and this way you have all your stuff. A very important point is do not save your password in the browser. That is kind of dangerous. So let me show you the next point, LastPass. So LastPass is not a product that we sell, but it's a product that we use internally. So with LastPass, let me just show you how I use it, and then I'm going to show you more about it and how we share it together at Microwize. So for example, let's say I log into Vozetta, which is something we're going to talk about if you have not seen that yet. And when I'm logging in, I might be logging in with different accounts depending if I'm playing a patient or if I'm playing a demo provider or I'm helping a provider with their own logins. So let's say I'm logging in here as a provider. So what I just did, I was able to log in so quickly without anybody sitting next to me able to see what's my password. Now I can log into any computer, to any accounts, to any device. I could be on my iPhone, iPad, I could be in my home computer, I could be in my work computer, I could be in my replica office. I can log in so quickly without having to compromise my username and passwords. It's all saved, and you log out of your LastPass all the time to keep it safe. I'm going to show you my vault for LastPass. So this is my vault for LastPass. Before I finish for the day or go to lunch or anything, I log out of my account. And I also have a two-factor authentication. So even if you know my username and password, you will not be able to get in unless you have my two-factor authentication. So examples for two-factor authentication, or sometimes it's called two-steps verification, where you receive a text message on your phone, which is hopefully you're the only one have access to that, and you repeat that code that you get on your phone. You enter it to verify who you are, or there's apps. So there's a Google app and there's something called Authenticator. LastPass has their own app to be able to authenticate you. So you can use that app as well. So this is everything I have in my vault. So let's say if I want to log into my Tesla account, so by just hitting the launch, I'm able to get in without when you see a number like that, that means I have two accounts. I can pick and choose which account I want, and I can just get in to my account. So this is just a sample of what I use it for. Now, when you're creating an account, it's very simple. So let's say I'm creating on Rosetta. So let's say I'm creating an account, and let's say that account is patient. So when you type in your information here, when it comes to the password, so what you need to do is, let's say this is a new password that I'm creating. So you right click your mouse, you click on LastPass, and you say generate a password. So what the system is doing is you can configure your LastPass how complicated you want that password to be. Let's say it's something that's you want it to be 16 digit, and maybe you want to have upper cases, lower cases, special character if you want it to be like based on words, you can do it like that, or you can make it random numbers and characters, and you can use special characters. So that's how I would just create that password here. Now it fills it for me. It asks me, you want to update this because I'm logging in with something I logged in before, or I want to create a new one, or maybe not. So this is how you create your own password, gets logged into your vault, and you can have a sophisticated username and password. Why this is important? Because many of you might have the same username and password over and over again. Then you maybe have 3 4 different variations, something for the complicated, the more complicated, but they're all driven out of the same, maybe your daughter's name, or maybe your date of birth, or maybe, and you get creative and you add a character. Hackers, they figured all of this out. If hackers were able to break into one account that you use, it could be your social media, it could be LinkedIn, it could be Yahoo, it could be Target, it could be the New York Times. Many of those got hacked before. Anything like that can get hacked. If the hacker gets your username and password, they sell it in the dark web. And once they sell it in the dark web, there's people pay money for that. Other hackers, they pay money for that. And they're able to, we all know that we all work with confidential information. We have patient information, we have financial information, patient protective information, PHI. So you want to make sure that you don't put your business, yourself, and your patient at risk. Don't keep everything with the same username and password. It's a no-no. You want to use something like that. Or there's other services out there. You might wonder why this is relevant to the coronavirus, or the contingency plan, or the emergency time that we are in. Because when you out of your normal environment, you might be more at risk. As the economic problem hits in, there are more and more people is going to turn into crimes for having a source of income. Crimes was always high, but now it's going to be higher because of this. I keep a lot of things here. So let's say if I want to give access to one of my employee to work on my LastPass. Maybe they need to do or maintain something. So I can share my account with someone. This is everybody within the company. So let's say I want Maria to access that. If I want her to see my username and password, I can turn this on. If I don't turn this on, you need to turn it before you pick her name, by the way. If I don't turn this on, she will able to log in without actually seeing the username and password. So she will get an invitation, and when she gets the invitation, it will be something called the shared center. So that will be all the stuff that were shared, and you will be able to log in without actually we actually have to see the actual username so I can launch it without getting in to get the username. Anytime you have availability to do two-factor authentication, you need to do that. That's what keeps your life secure. I also able to put a lot of stuff, maybe my credit card, maybe my bank accounts. So I have all of that stuff. So when I create something, I can choose the name of it, I can choose the folder, then I can choose the type. Type could be a generic, where maybe I'm keeping important information there so I can access it from anywhere without having to keep it in my wallet or to keep it in the back of my phone, like some people do. It could be a bank account, a credit card. So this is all custom information that I can, depending on what it is. And once I make it, I can also share with other people in my organization. You don't want to text somebody your credit card, or you don't want to text one of your confidential information by email or by text. The next item I want to talk about is your actual computer setup itself. We are in the beginning of April now. We've been in social distancing. Businesses are shut down for almost a month now. We might go on like this for another. I want to make sure that you guys are able to go back to work virtually. The government and Medicare and most payers, they relax a lot of the regulations so you can stay in business and be able to operate remotely and get paid the full amount that you normally would get paid in a regular office. To operate remotely, there's certain things that would make it easier for you to operate. For example, seeing a co-worker face to face. By having a camera to meetings, it makes more sense when you see the people and the body language when you're meeting with those people. We're going to talk about telemedicine. We're going to talk about that part, but I'm talking about your daily meetings with your staff. If they're working remotely and having the proper setup, you're able to conduct your normal business as if you were face to face with them. So camera makes that easier, because you want to make sure that person is paying their full attention. They're not doing the dishes while they talking to you on the phone. You want to have business meeting. A camera makes that a lot easier. So they're not that expensive. Those cameras are not that expensive, but they're very effective. Also, one of the mistake we make is most people don't have enough space. So what they do is they try to work on a laptop. Laptop are not designed to work on it every day. Now, I don't know about you, my normal day is 10 to 12 hours at the office. When I'm working from home, believe it or not, I'm actually working 16 hours. You want to make it as comfortable as possible for you and for your staff. So dual monitor is very important. Why? Because if you're going to operate paperless, you want to probably have a super bill on one side of the screen, and the other side of the screen is the application. Maybe you have an intake form, it will be on one side of the screen and your application is on the other side of the screen. So that makes it easier to be paperless, and it makes it easier and more comfortable. You don't want to work on a small computer with a small keyboard and a small monitor, and you wind up putting a stress on yourself, stress on your back, stress on your neck, stress on your eyes, and stress on your hands. By having a comfortable setup, look at this computer here that I have, is a small computer that doesn't take much room, but the monitor is large. Those 227 curved monitors. So the curved monitors, they don't take as much room as if they were flat monitors, and they're actually more contained to you. It's almost like you are your own pod here, and it's really nice. And I'm going to show you a closer picture on the next screen. But before that I'm going to talk about a couple more things. When you're meeting with your staff, this is not telemedicine. When you're meeting with your staff, the two most popular applications are Team and Zoom. I actually happen to use both of them. So let me show you. Each one has its pros and cons, and I was not sure which one I'm going to standardize on, but we use both at Microwize. So with Team, I'm able to chat with my staff, okay? And I'm able to call my staff. I can call them with the camera or call voice soft phone. So this is a great way of having your own internal communication with your staff. I can also share my screen with them. If I wanted to teach them something, or they having a technical problem with something, they can show me their screen and we can troubleshoot something together. The other thing is I'm going to show you Zoom. So Zoom is I can actually create a meeting on the fly. So I can create a meeting, and now I can actually invite another person. I can record that meeting, or I can invite another person. So I can just go to participant and I can invite, and those are the people in my company that I can invite that using Zoom. So I can just click on the people that I want and I will hit send, and that will create a meeting on the spot. Each one of those applications has pros and cons. Zoom is easier to have an external person to join you. Team is a little bit more challenged. Now, Team can be a part of Office 365. So, an Office 365 is it depending on which package you get. So you can have a package where it has Excel, Word, and PowerPoint, and Team can be part of that package. So let me show you that this is another piece that it's important is having Microsoft Office 365. When I have a document, so let's say I have a document, let's say Rosetta fixed list, and I want to share that document with other people in my organization or outside of my organization. I can click on share, and I can pick and choose who can access that document and how much power they can have over. So I can type their name here, and I can choose here the security that I want. Okay, I can choose if anybody can edit it or only specific people can edit it. So this is using a Word or a presentation or spreadsheet in the cloud. This is storing it in the cloud, so it's not stored on your computer. Doesn't matter now which computer you are in. You can access all your document in the cloud, so you can work from anywhere at any time. Now, this is just a closer look to the setup that I'm talking about. So this is the camera, uh, this is the two monitors, this is the computer, a full keyboard, enough space to work and stretch yourself. That setup is around $1,000. It's not a lot of money. You can have so many people went with that setup today, even before the coronavirus. Have one setup at the office, one setup, a replica office, which is the home. I have a replica office for each employee at Microwize. So this way we can work at the home, we can work at the office, and functional 100%. Now, the next thing I want to talk about is the voice over IP. So I showed you, of course, through Zoom or through Team, you're able to see and you're able to talk to a coworker. But what happens if your normal phone lines and how you're going to answer that phone? So if you have a voice over IP, you can log in or take that phone with you anywhere in the world, plug it into an internet connection, and boom, you are up and running. Doesn't matter where you are. So that voice over IP is just worked by internet. That's what IP for, internet protocol. So you're using the voice over the internet. I did the survey, and I see that only 30% of you that have voice over IP are the ones on the phone today, which is kind of low. If I'm showing you an image like that, that means it's something we offer. With voice over IP, you can actually have a professional menu, you can have a nice greeting, you can have after hours, during hours menus, you can have queues or departments. For example, push one for billing, two for making an appointment, things like that. Let me show you the voice over IP that I use. So over here is if I'm typing the name of the person, or I can type the extension. So let's say I want to call Justina. It shows me the status if the person is in a meeting, on the phone, or out of the office. Her extension, and I can call her anyway, or I can text her, or I can leave a message. Also with that, I can use what's called a soft phone. So I'm using a hard phone here. If I want to use a soft phone, I can switch that and I can choose a soft phone. So when I'm using a soft phone, I can use a regular headset that I have attached to my computer. I don't need a hard phone. So that makes it easy if you don't want to keep carrying your phone between the office and the remote office or your home office. So I can use a soft phone. A lot of voice over IP phone systems, they do that. So that's an important feature to consider. So let's talk about Rosetta Telemedicine. So Rosetta Telemedicine is, I created this new company. I invested in the creation of Rosetta. Rosetta was designed to have patient find providers, be able to book an appointment, and that appointment could be a regular office visit or a virtual visit, which is called telemedicine. Because of what's happening, I am donating the technology to all of you until March 2021 or until any further notice if something happens to the regulation. So now you can operate remotely and keeping you and your staff and your patient safe and able to stay in business and operate. Government will, and the Medicare and Medicaid, they relaxed a lot of the telemedicine regulation and allowed you to see the normal visit through telemedicine visit and get paid. Before we talk about the coding and the billing for telemedicine, let me just show you a quick preview for a pre-recorded session that I created for a telemedicine visit. To conduct a telemedicine using Rosetta, you can use any device that has a camera. In this demonstration, I'm going to use an iPhone. The patient is looking for an appointment, then clicking on the spot, then now filling what insurance the patient has, picking what plan they have, clicking the book appointment, and now the appointment is set. Now, on the other side, the physician is logging in. As a physician, I do see the appointment. I can start the appointment when the patient is ready for me. So when I click the start, I will see my communication confirmation. Then I'm going to wait for that call button to turn darker blue. Once it turned darker blue, that means the patient is ready for me or connected. Once I hit call, then now it sends a message to the patient on the other side to accept it, and now I'm ready to talk to the patient and conduct my exam, and this is a telemedicine visit. I am also able to chat with the patient, and I'm also able to receive and send files to the patient. When I'm done, I end the visit. In case if you want to cancel an appointment, you want to cancel it from this view here. You want to click on cancel button here, and that's it. That's how simple it is. So let me go back live to Rosetta.com here. So this is if you filter by specialty, or you filter by zip code, or filter by plan, this is what the patient sees. They can use it on an iPhone, iPad, or Android. Um, they can search for virtual visit, or they search for an office visit. So the plan through this was to bring you extra business, to have patient find a particular provider at a particular area for whatever specialty you are, and able to bring a patient can find you and book an appointment for you. I've been working on this for multiple years now. Patient can book a virtual visit or an office visit. So depending on which one they see, they will, when they search, they're able to see all the providers in that area. I didn't pick an area, so I'm going to see everybody. This is just going through, and this is the providers that actually see in telemedicine. This is the pen of providers that already signed up. As a patient, let's say if I want to book this provider here, if I want to know more about that provider, I can click on that provider. I get to see their credential. I get to see if I didn't filter for a particular credential, and I get to see where they located on the map and what availability they have. Then I can pick the appointment slot that I'm looking for. So if I'm looking for this appointment now as a patient, I can log in and I can put my insurance information and book that appointment. I also created something that I think it's good to have. We get a lot of patients going to Rosetta and they asking, how do I find a provider that will screen me if I should go to the hospital or not for Corona? Now, a part of the relaxed regulations that I understand is happening is, you, as a physician in one state, you can see another patient in a different state related to COVID-19, and you're able to get paid from the insurance company regardless of what state you're licensed in. So they kind of relaxed it, so because there's shortage in physicians, so they're going across states. So the way I understand it is, you could be in New Jersey and see a patient in Iowa. So I created a category for COVID-19. So if you want to see patient related to COVID-19 and screen them over telemedicine, you could list yourself here, and patient will be able to book you to do telemedicine screening for COVID-19. So hopefully this will help you to, we have a question, and the question is, to operate now, how is this different from FaceTime or anything like that? You're able, as a provider, let me log in as a provider. As a provider, you'll be able to see who booked you. You'll be able to see the history of that call. You have a proof that this patient did see you, and you can organize your calendar where patient can actually book you. And if once they book you, that appointment is no longer available for other people, so you're not having double booking. Right now is, if you're seeing 5 patients a day, it's not that big of a deal where you can see them with a regular iPhone or FaceTime. But if you want to run a full operating virtual practice, something like that, it will organize your appointment much better than doing manual type of connections. I'm adding more features, so there's more features coming out next week where you can actually send an invite to a patient that don't have an account, and you're able to see them through telemedicine. I will show you that next week. And we've been trying for the last 3 weeks, we've been trying to meet every Friday. Actually, we've been meeting every Friday at the same time. So hopefully I will show you that next week, where you can invite a patient that don't have an account on Vozeta, and you're able to see that patient. I'm calling this a virtual walk-in. So back to the presentation. So the other thing that can help you is Billflash. Billflash is a very good service that integrates with Medisoft or Lytec. With Billflash, you're able to send statement electronically. Patient can pay you electronically, or you can take payment over the phone, so you don't need the credit card reader at the office. You can operate your business if you haven't done that yet already. Most of my customers are already on Billflash, but if you haven't done it yet, I will highly, highly recommend. We also have one more thing. It's called the remote employee. If you're not equipped to operate and have your employee run remotely, we do offer a remote employee service. So let me just show you a quick presentation on that.
Looking for an extra hand? Well, it had better be sanitized. Or what if it were virtual? I'm talking about Microwize, offering remote employees who can help your medical practice with front desk or back office functions such as answering calls and taking appointments, following up with accounts receivable, running reports, and printing patient statements. A fully qualified employee who is medical billing certified and HIPAA trained is ready to join your team and hit the ground running. Regardless of whether you need coverage for someone on a leave of absence or workforce augmentation, a Microwize remote employee is your best choice at only $475 per week for a full-time employee plus a part-time supervisor. It is the best thing you will do for your practice. Never worry about payroll, sick time, vacations, medical or dental insurance. A Microwize remote employee is an amazing option. Don't compromise. Go Microwize.
So that was the remote employee service. If you're not equipped to have your employee work remotely, you can hire one of my employees to help you. Also, I'm surprised to see most of you on the call today that don't have Medisoft Cloud or Lytec Cloud. So the Medisoft and Lytec Cloud is the same Medisoft or Lytec that you might be using today, but it's in the cloud. I can access it from anywhere in any computer. On a Mac PC, from any browser, I can log into my Medisoft or Lytec. So you're not doing the remote desktop, which is, I think it's high as far as security. Before we get into the telemedicine billing, do you have any questions?
Robert, may I ask?
Sure.
I was under the impression that Vozeta, once the patient is making an appointment, it dovetail with our existing practice management software like Office Hours of Medisoft. Is that correct?
I am working on the interface. So I kind of rushed Vozeta to be out to help you guys. I was still working on that feature. So that feature should be ready in about 2-3 weeks.
Thank you.
You're welcome. So you're using Medisoft Office Hours now, correct?
Yes.
Okay. So right now is you will be getting an email that there's an appointment. And what you need to do is you need to block your Medisoft so you don't have double booking. I'm working on making that interface seamless. So when somebody books it and manually in your Medisoft, it removes it from Rosetta. And if somebody books it in Rosetta, it puts it in Medisoft. So that's a lot of, there's a lot of moving parts here. So that part is not easy. So it's probably going to take me another 3 weeks to get that. Okay.
Thank you.
Great question. Thank you.
All right. So, hi, everybody. My name is Amir Gadol. I'm the General Manager for RCM. I hope everybody's staying safe. Nesma is going to be helping me today with giving you brief updates about the telehealth coding and billing. It has been the same since last time we had our conversation last week. There are no major changes that has been coming up from whether Medicare or other insurance companies. So it's pretty much the same. Nesma, if you can go ahead, please, and start.
Actually, while Netsma gets ready, I updated the document on the website. So if you go at the very bottom of Microwize.com, I do have this document right here that has the latest. So this was updated today, and that has all the latest codes and all the latest terminology. Go ahead, Nesma.
Hello, everyone. This is Nasma. So in regards to the telehealth, because Medicare now and the other insurance companies, they would like to make sure that the providers and the patients all are staying at home and make sure that there is no like risk of going out because of COVID-19. So right now we do have the telemedicine, that the services that used to be done at the office, instead of just going to the office and have contact with the patient or have contact on your way to the office, it can now be done like the phone, or it can be done through audio and video. Medicare actually updated their like guidelines and rules when it comes to this. So right now, the regular E&M codes that like each provider used to bill in the office, they can actually be done now through audio and visual. So it needs to be audio and visual. It cannot be audio only if we will be billing like a CPT code that it's for a regular E&M code. The coding for the services that were done will actually be based on time or the complexity of what was done during this visit. The place of service is the regular place of service that you will be using if you've seen the patient in the office, which is 11, or if it was the patient inpatient or outpatient or a nursing facility. It's a regular place of service, and the modifier used will be modifier 95, just to indicate that that was a telehealth services. That's for the regular E&M, so it needs to be audio and video. We need to use the regular place of service as well, modifier 95. And there will be on our website all of the information, along with a link that has the CPTs, all of the CPTs that Medicare covers as telehealth. And we do have other types of telehealth. If the patient does not have like video, or if the patient, they are not very good with technology, and they cannot actually do audio and video. So there are some codes for phone calls that it could be like a phone call. And there are specific codes for it that goes from 99441 to 99443, depending on the time that the provider would actually spend talking to the patient. And when actually coding for like audio visits only, which is over the phone, there's no need to use any modifiers. Like modifier 95 is not needed at all. We just use like the regular place of service, and that's it. And there is like other types after the like the phone calls. There is a virtual check-in. A virtual check-in when actually the patient is just giving the provider an idea about their symptoms, and there are two codes. If the patient actually called the provider, there is a code, and if the patient like forwarded images and videos to the provider, that's a different code. So for the phone calls, the code would be G2012. And for the images and video would be G2010. Of course, there are some restrictions on using those codes. They cannot be used 7 days prior to an office visit or an E&M usage, or no E&M visit would be done after 24 hours from like a virtual check-in. In that case, or if the patient case actually needs an office visit or an evaluation and management, the virtual check-in CPT code won't be actually billed. And the last thing, it's actually an online digital E&M. Online digital E&M, it's done actually through a patient portal, and that's It's like a way of sharing information between the patient and the provider. And there are 3 different CPT codes for that, from 99421 to 99423, depending on the time that the provider would spend checking the patient's case. But actually, from like my experience and from what I'm seeing with all of our providers, most of our providers would actually care more or will be using more the E&M codes, like the regular E&M codes and the phone calls, the audio.
Robert, will you be adding orthopedics to your Vozeta profile?
You mean as an icon?
As an icon and obviously as a specialty that patients.
So you can type orthopedic and you can just pick orthopedic surgeon, filter for the zip code and hit search. So the list is alphabetical. To go back to the list, I can just go down the list and there's almost every specialty here. If I missed anything, just let me know, I'll add it. But the icon is going to be based on who has the most sign up. So they're going to get an icon. I might add another row of icons, but I can't add 100 different icons because there's so many specialties. Based on the number of count of providers in each specialty, they're going to get an icon. Does that answer your question?
Yes, thank you. That's great.
Is this Ingrid?
Yes, it's Ingrid.
Okay, hi Ingrid.
Hi.
Okay.
We're talking a lot today.
Okay, good. All right, let's go back to the presentation. Thank you. Thank you, Nesma. Thank you, Amir. Anybody else has any questions?
I have a question, psychiatry, code 90836 after the E&M code. Can that be done by phone if the patient is unable to use video?
Nesma, can you answer that?
Actually, for the usage of any codes, it would differ from like one insurance company to another, depending on like their rules and regulations. And always, for any information about this, like all of the insurance companies right now, they do have a section on their website about the telehealth, what codes they are approving, and what's the special circumstances or the special requirements that they have for each CPT code. Just to make sure that what you're billing is actually according to what the insurance company is approving, I would actually advise you to check the website for the insurance company that you're trying to submit the codes to.
I have tried to reach both Anthem and Empire unsuccessfully to find any such posting information.
So what happened if you just send the same code that you would bill at the office, use the 95 modifier? What would happen? Have you tried that?
We will find out. That's what we're trying.
Okay, speaking of that, is anybody on the call get paid for telemedicine visit yet? Well, hopefully by next week, I will have some of you that already get paid. Just send a few claims. Let's make the assumption that it's the same office visit that you have at the office, and just modifier, same place of service, just modifier 95, and make sure you have it documented that it was a telemedicine visit. And hopefully by next week, some of you already got paid.
Yes, I have a little bit of information on Anthem's website. They have that you need to report 02 as the place of service with the codes that they list and the modifier 95 for their commercial plans. So they're asking us to change the place of service for telemedicine to 02.
Now, that was the situation with Medicare about 2-3 weeks ago. Then it was confusing and they said, you know what, just 11 or whatever place of service you do, and just give me a 95 modifier.
Yeah,
now,
I just want to highlight one thing that Renee just said. You can still bill with a place of service 02, but the reimbursement is going to be less than the reimbursement that you should get out of putting the normal place of service that you would and just adding modifier 95. So yes, you can still bill for it, and it will be paid, but the reimbursement is going to be less.
Okay.
So the way we understand it is we are in an emergency period now. During the emergency period, they allowed you to bill the normal visit and get full payment as if it was in your office.
Exactly.
So if you do O2, that's going to work, but you're going to get less money.
Okay.
Now, you might not be able to do that 4 months from now. We are just during emergency time. They don't want to cause you financial harm. Well, hard to believe that, that they want to pay you, but it looks like they do want to pay you. And if it doesn't work, please give us a feedback. We want to meet on a weekly basis and kind of help you with this because we are all into this.
Okay, will do. Thank you.
Okay, well, thank you. Any other questions?
Yes, Robert,
Yes.
you mentioned with this Vozeta service
Yeah.
that you would have documentation of the visit. What kind of documentation? Is it just the electronic exchange, or is it a recording? Can I file it in the patient's chart? What does that mean?
Excellent question. For security purpose, all I collect is the log that you spend 15 minutes or a half hour with the patient. I don't keep any conversation. I don't record any videos, and because that brings a lot of responsibility with it. All I do is keep the log of that you spend, whatever amount of time with the patient, and you have a log of a report for all the patient you saw and how long it took. I want you to think of Vozeta as another exam room that you have, that it's virtual. You need to document it the same way you're documenting now. You need to bill the same way you're billing now. You're not changing your billing software. You're not changing your EMR or your documentation. If you used to document by hand, you need to document by hand. If you used to document using an EMR, you need to document using the EMR. Vozeta is not a billing software. It's not an EMR. It's just an appointment booking and a virtual exam room that you have.
Do I have the option via the service or through the service to record the meeting with the patient and
No.
then? No. Thank you.
Why would you want to record the meeting with the patient?
Well, for medical legal purposes. Let's say there was a question the patient didn't understand. He got an instruction, just like a regular chart.
If I was physically in your office, are you recording my conversation with you at the exam room?
I am writing it down. I'm not recording it. I'm not audio recording it. But I am I'm keeping a record of it.
11:45. Okay.
Okay, you need to do the same here.
Gotcha.
Document it in your note. Don't worry about recording the meeting, because I want you to think of Vozeta as a virtual exam room. It's another exam room you have. So whatever you used to do in your exam room, except physically touching the patient, that's the only thing we're not able to do, or at least not yet. So it's a virtual exam room. You document and you do everything else the way you used to do it now.
Gotcha.
Or before.
Thanks.
Good question. All right. Well, stay safe, everybody. Thank you so much for taking the time. Happy Easter, happy Passover, and enjoy your weekend. Hopefully, every week we'll meet again and give you updates. Thank you and have a wonderful weekend.
Please don't keep us a secret. Tell everyone about Vozeta Telemedicine. Social distancing friendly and virtually free. Vozeta Telemedicine. Give Vozeta a try.